In terms of screening for hyperlipidemia, we know that statin use decreases all-cause mortality in what we would call middle-aged and young old, so those that are age 65 to 75 years of age. However, the combination of studies, PROSPER, JUPITER, and HOPE-3, indicated that the statins were associated with a modest reduction in cardiovascular disease, but really no benefit in overall mortality in those that were 75 years and older. And part of the problem is that a lot of the risk calculators, once you hit the age of 75, everybody's got excessive cardiovascular risk. And so, basically it would mean that everybody over the age of 75 would need to be on a statin. And there may be some discussions about the value of that, but I think by and large, the average life expectancy, again, for men is 78 and for women is 81. So you're already under that 10-year risk factor already just based upon average life expectancy. So from that rationale, it does not make sense to consider statins at those higher age groups. Well, decision-making about statins, there's a reference here to Statin Decision Aid by the Mayo Clinic, so I'll refer you to that. Just kind of point out the Salvador Dali double imagery here, where in the middle you might see a goblet, and then you also see an older woman and an older man, but both of them are, you have a older senorita and a guitarist here on the right. So there's a lot that's hidden in the Salvador Dali surrealism, and so too in geriatrics. We often have to dig deep to find some of the problems that are not always facing us. In terms of hepatitis screening, there should be a one-time screen for hepatitis C, basically in the baby boomers. And we should screen adults at high risk of infection with hepatitis B surface antigen. Those are certain professions, phlebotomists, providers, healthcare providers, researchers, and those with alternative lifestyles. Healthy lifestyle counseling. So part of the issues here is that we want to promote physical activity. It's a tough one, but we'll talk about that a little later on in this presentation about best strategies and what actually you need to prescribe. In terms of nutrition, it's important to identify older adults with 5% weight loss in the past 6 months, or if they have a BMI less than 20. In terms of alcohol, well, we'll talk about alcohol screening, but I think it's important to point out what I call the 2-for-1 rule, which basically is that for each single drink of alcohol, they're equivalent in terms of metabolism to 2 drinks. And so I think it's always important to tell or explain to older adults that their metabolism changes with age, and that 1 martini that they may have in the evening may actually equal 2 martinis, and so forth. So the 2 beers are 4 beers, and it goes along with the impact that the higher drinking level will have. And I think that's important, particularly for individuals that may have falls. In terms of smoking, it's always important that you use each visit as an opportunity to stop smoking, no matter what the age, because it's been demonstrated that smoking cessation, even in your 70s and 80s, does result in some improved airway adaptation and responsivity. And we'll show some data about that later on in this presentation. In terms of counseling on STDs, usually I find individuals that are considering transferring from a private residency into a retirement community, that probably would be the best opportunity to talk about sexual activity, particularly if they're a single individual. As it turns out, and we'll see in a little bit, that STDs are on the highest rise amongst the 65 and older age group in the United States. In terms of latent TB, you want to consider immigrants, refugees who have come from areas that were exposed or have high exposure to TB, and I'll show you a heat map a little later on as to where those areas may be. In terms of prescribing physical activity, I think the most important thing is to set a mobility goal. I think everybody knows they should have a walking program, and there was a a great story of a 83-year-old gentleman who came to my clinic, and his daughter also came with him, and she says, "Oh, I'm really worried about my dad because he's on the treadmill like all day long." And I asked him, I says, "So is that true? Are you on the treadmill?" And he goes, yeah. He says, "Okay, well, that's fine." And then the daughter stepped out for a phone call, and I asked him, I said, "Why are you on the treadmill all day long?" And he goes, "Oh, it's because the babes are there. It's really easy on the eye." So I thought to myself, at the age of 82, all the better, buddy. In terms of set goals, is that we know that 5 miles walking a day is pretty much the cutoff that we want for improving health outcomes. Separate from the steps acquired daily are just basically aerobic exercise, which could be either through walking or bicycling or other forms of exercise, even dancing. That you have moderate intensity exercise for 30 minutes, 5 times weekly, so a total of 150 minutes. However you get those minutes. They all don't have to be at once, too. You could do like 15 minutes in the morning, 15 minutes later on in the day. We don't recommend physical activity after dinner because that really disrupts the sleep cycle. There's increasing information that high intensity is superior in some cases. We don't know this for the older adult, certainly for the younger individuals. So you can actually reduce your cardiovascular mortality by 40 to 50% with high intensity training. So there are some programs now for high intensity interval training, but it remains to be seen whether the older adults benefit from that so-called HIIT, H-I-I-T. And so that's ongoing research is the bottom line there. The aerobic exercise needs to be combined with twice weekly resistance training, and some people advocate that you do the resistance training for a couple of weeks, up to 4 weeks before you start an aerobics program, because you want to build up muscle mass, your lean body muscle mass, and you want to build up consequently the mitochondrial load to help with the energetics of the aerobic exercise. And then finally, we want to add core and balance training. So those are things like yoga, doing the tree pose, or Tai Chi is proven to be of great impact on core balance training. And then also various forms of dancing. And apparently it doesn't matter which style of dance you pick. It actually has the added benefit of socialization, which is probably a bigger longevity boost than the aerobic exercise itself. In terms of nutrition, it's kind of interesting that BMIs between 25 and 29 have the lowest mortality risk. So this came out of the Baltimore longitudinal study that showed a slight benefit towards reducing mortality in people that were just a little corpulent, but not too much. So that's just kind of curious, and some people think that that's because it's of a nutritional reserve or caloric reserve, that when people get acutely ill, that kind of balances things out. However, individuals greater than with a BMI greater than 30, they have increased mortality. They have a reduced overall functionality. And so weight loss in those individuals would be important, but it would be valuable to combine that with exercise, and for the primary reason that you can have older individuals that are obese that have sarcopenia, which is loss of muscle mass. So you don't want to further compound it by caloric restriction, and they actually should be on high protein diets to avoid the so-called sarcopenia. So epidemiologic studies show this final point here, that 15% of older adults are malnourished, and you could do a more refined screen. I like the Nestle Mini Nutritional Screen. Also, the St. Louis Rapid Geriatric Screening contains a good nutritional, a quick nutritional screening tool also. In terms of alcoholism, there's two tools that you can use. I prefer the Michigan Alcohol Screening Test, but the other one is Audit. We're no longer using CAGE because that's not as sensitive or specific in the older adult population. And I just kind of want to point out that the highest risk for alcoholism in the older adult population happens to be white women who have recently retired from their jobs. So just kind of an epidemiologic note there as to who might be a target for your alcohol screening. I also want to point out that I have prescribed a glass of wine to some of my older patients because of the cardiovascular benefit. However, that's balanced by the negative effects, obviously, with the reports of any alcohol increases the risk of cancer at all ages. Yeah, so this is the smoking cessation point that I wanted to make. Basically, the approach is to try to identify a quit date, to discuss the types of therapies that will be part of the smoking cessation program, and really to have then close follow-up either by a health coach, if you're in a patient-centered medical home, or by the provider, and to do so on a regular basis to see how things are going. However, I wanted to point out in terms of getting individuals to consider stopping smoking at older ages, like age 65. And this is a British study here on the right that basically did pulmonary function tests, and they reported the FEV1 to the middle-aged to older adults, and they said, you, sir, you have the function of a 70, so you, Mr. 50-year-old goes over and you say you have a lung function of a 75-year-old. And so all of a sudden these middle-aged people thought that they were like prematurely aging. And so quite a few of them took heed to this and stopped smoking based upon ageism, quite honestly. And with also the report that by stopping smoking, that they could convert their trajectory of lung function to those of an individual who never smoked, although it'll concomitant lower overall functionality. In terms of CDC guides for STD screening, so most of the recommendations are for people under the age of 65, but look at the graph here. So you can see the different ages. And this is the percent of increase in office-based treatment of sexually transmitted infections. So this is from a large healthcare system, but I thought it was just pretty provocative to see that that there's been nearly a 25% increase in individuals over the age of 60 who are being treated for STDs. And the other point in terms of STD screening needs to be focused on higher risk groups, such as gay and bisexual men. And then for women who may have multiple sexual partners would be a good discussion for exposure and screening. As I mentioned, I'd provide a heat map for latent TB. So these are refugees that come to the United States from these different areas. India and Pakistan, Bangladesh, some of the Southeast Asian areas, Southern Africa, even some parts of South America. And much to my surprise is that there's a sort of an in-between middle-of-the-road rate of tuberculosis from that very populous area called Greenland, as you can see up here. I have, in my entire clinical practice, I've never had a patient immigrate from Greenland, so I don't put that high on my list for worrying about where the TB is coming from in that particular region. But again, just remember that there are areas here in North Dakota where we're constantly screening Somali refugees that have come to the Minnesota and North Dakota region. Yeah, so the other thing is to screen for geriatric syndromes. So I just wanted to point out that if you apply comprehensive geriatric assessment, which is part of another presentation series that we've done, is that it works. It improves overall physical and psychological functionality. The patients have better qualities of life, or at least that's what they report, and better satisfaction with their clinical care. So even if you didn't have any thoughts about geriatric assessment having an impact on the older adult, it certainly will make them happier with their clinical experience. So for those of us who are assessed by the Press-Ganey reports, we all understand what that means in terms of getting good 5-star ratings by our patients. But that aside, that's not the important part. It's really the impact that geriatric assessment has, which reduces acute care, and it should be a component of the annual wellness exam.